Why are catheters inserted in the urethra into the bladder during AV birth? So in a completely uncomplicated labour and birth, there's no epidural on board, baby's not in a funny position where mum is able to pass urine herself throughout that labour and birth process, there is absolutely no need for a urinary catheter at any stage. Most women are able to go to the toilet themselves, pass urine themselves, and there is no issues, no problems, no complications whatsoever. Therefore, the urinary catheter is not needed at all. The most common reason to have a catheter inserted into the bladder during labour is for women who have got an epidural. Epidurals numb women from the waist down, and a full bladder can stop labour, it can also slow down labour, it can stop the baby from descending into the pelvis, and also it can increase the chance of a postpartum hemorrhage after birth. Having a full bladder in labour as well, if it overstretches the bladder, can lead to an increased chance of urinary incontinence later on in life too. So really important that with an epidural that a catheter is inserted either as an in and out every time that an examination happens to make sure that bladder is emptied very frequently. Alternatively, a catheter that goes in and stays in, it's called an indwelling catheter, stays in with a bag attached that empties the bladder continuously, and then that's removed when it comes to the pushing stage. Now the next reason can be that the baby is in a really funky position and is blocking the urethra. And so for women who are unable to go for a wee every 4 to 6 hours, sometimes a catheter is recommended because, again, if that bladder overfills, it can stop the baby from coming down, it can stop the baby rotating, it can lead to an increased chance of postpartum hemorrhage after birth and potentially needing oxytocin as well during that labour and birth to speed things up again. And a great tip for birth partners is to encourage mum-to-be to be able to go to the toilet more frequently during that labour and birth process. That will keep that bladder really empty, that will help baby get him into a good position and make mum feel more comfortable too. And the next most common reason for a catheter to go in a V-birth is if there's a big bleed after birth. So if a woman is having a postpartum hemorrhage, one of the ways to stop the bleeding is to empty the bladder, the uterus can contract down far easier and therefore hopefully reduce the amount of blood loss a woman has. A catheter will only be inserted alongside lots of other things going on, but it's one of the measures to be able to help reduce the amounts of a postpartum hemorrhage a woman has. There are some other reasons why catheters can go in during labour and birth. One is to monitor urine output for women with preeclampsia, and that's to continually check that the kidney function is still okay. The next reason can be obstructed labour, so baby's got stuck somewhere along the lines. Women are unable to pass urine, they go into urinary retention. Again, a urinary catheter can sometimes empty the bladder. And the final reason that a catheter can go in after a V-birth is either after a urethral or clitoral tear. There will be an individual plan made with the obstetrician as to how long that catheter needs to stay in for. As I said at the beginning, if everything is straightforward, there's no complications, there's no concerns, women don't need a catheter at all.